This is National Native News. I'm Antonia Gonzalez. Ahead of the next legislative session this month, Arizona Democratic state lawmakers held a town hall at the end of December on MMIP, or Missing and Murdered Indigenous Peoples. KJZZ's Gabriel Pietrorazio has details.
Indigenous Peoples Caucus Chair Senator Sally Ann Gonzalez, who is Pascua Yaqui, made no promises.
We will not have solutions for you today.
But she and others spent 3 hours listening.
Listening without action has become a pattern.
Reva Stewart, who is Diné, believes families relive their trauma by testifying with no results.
Legislation without enforcement is not protection. Task force without authority or accountability are not solutions. Meetings without funding are not justice.
Roxanne Barley, who is Kokaput, complained that criteria changed for the state's Turquoise alert, originally designed to notify the public of Indigenous disappearances. Of the 5 alerts, only one has been for a Native American, a teen in Yuma.
That was the lie that we were promised. That was the hoax that we were told.
But Senator Teresa Hatachli, who is Diné, explained how lawmakers compromised.
And that is the ugly truth of politics.
For National Native News, I'm Gabriel Pietrorazio.
Alaska state health officials continue to recommend the hepatitis B vaccine for all newborns, despite a recent controversial change in federal guidance. The virus has historically seriously impacted Alaska Native communities, as Alaska Public Media's Rachel Cassandra reports.
Hepatitis B is a virus spread through bodily fluids and from mother to baby during childbirth. Historically, Alaska has had high rates of hepatitis B, especially among Alaska Native people. In the 1970s, widespread infection led to high rates of liver cancer in Alaska Native children. State Epidemiology Chief Dr. Joe McLaughlin says screening and vaccinations have helped reduce rates of hepatitis B in the state. And McLaughlin says the vaccine is still important in Alaska, which has struggled with high rates of chronic hepatitis B.
This universal birth dosing helps to ensure every baby receives protection, regardless of their location, their access to care, or any follow-up challenges that they might have. This approach has definitely helped reduce disparities in hepatitis B outcomes across Alaska for decades.
Public health experts credit the vaccine with dramatically lowering the risk of developing chronic hepatitis B, serious liver diseases, and liver cancer. For over 3 decades, the Centers for Disease Control and Prevention recommended that all babies across the country get the vaccine at birth. Then last month, the CDC narrowed its guidance, recommending the vaccine only for infants born to women who test positive for the virus or whose status is unknown. The guidance says women who test negative should consult a healthcare provider before vaccinating their newborn. But McLaughlin emphasizes that the CDC also acknowledged that each state has to consider its own hepatitis B rates and risk factors.
Alaska, where the rates are nearly 3 times the national average, clearly falls into a higher risk category as a state in general. And our data support continuing universal birth dose vaccination to protect infants in Alaska.
Health insurers have said they will continue to cover the hepatitis B vaccine. In Anchorage, I'm Rachel Cassandra.
And I'm Antonia Gonzalez.
National Native News is produced by Kawanak Broadcast Corporation with funding by the Corporation for Public Broadcasting.
Support for law and justice-related programming provided by Hobbs, Strauss, Dean & Walker, LLP, a national law firm dedicated to promoting and defending tribal rights for over 40 years. More information available at hobbsstrauss.com. Support from Clarkson Potter, publisher of Turtle Island, Foods and Traditions of the Indigenous Peoples of North America by Native American chef Sean Sherman. With ancestral and modern recipes, this cookbook showcases diverse foodways of the continent's regions.
Native Voice One, the Native American Radio Network.